is a See Jason podcast, and I am Christie Rampersad from the University of Manitoba, Canada. On behalf of the study's investigators, I am delighted to have the opportunity to share our results with you. Although it is known that physical activity and function decline with worsening kidney function, the impact of dialysis initiation is unclear. In this study, we explored the difference in change of subjective and objective measures of physical activity and function in patients with advanced CKD who progressed to dialysis compared to those with stable advanced non-dialysis CKD. We included 386 individuals who had at least 2 assessments while enrolled in the Canadian Frailty Observation and Interventions trial. The CanFit study is an ongoing multi-center prospective cohort study looking at the longitudinal trajectory of frailty and adverse health outcomes in patients with advanced CKD, defined as an estimated glomerular filtration rate of less than 30 milliliters per minute, but not yet receiving kidney replacement therapy. Patients who progressed to dialysis also had an assessment after dialysis initiation, and they were included in the progress to dialysis group. And patients with 2 assessments who had not reached dialysis were included in the advanced non-dialysis CKD group. Patients' physical activity levels were subjectively assessed using the Self-Reported Physical Activity Scale for the Elderly, or the PACE questionnaire. Physical function was objectively measured using the chair stand test, 4-meter gait speed, and grip strength. Both groups experienced significant declines in self-reported physical activity level and gait speed. Average chair stand time also worsened in both groups. But dialysis initiation was independently associated with more than 5-second prolongation in chair stand time. Our findings suggest that dialysis initiation is associated with accelerated physical function decline as measured by the chair stand test. Future studies are needed to identify interventions to delay or prevent the decline in physical function associated with dialysis initiation. Thank you.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition, or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.